My name is Ashley Abuel, and I am the nurse manager for the Children's Heart Center at UCLA in UCLA Mattel Children's Hospital. So I've been a nurse coordinator in pediatric cardiology, I think for over 9 years now, working about 60% as manager or administrative, and then 40% still clinical nursing, which I enjoy, and I'm glad that I get to keep doing that. Then I work with the other nurse coordinators and other staff here in the Children's Heart Center to help patients get what they need, whether that be a doctor's visit or an echocardiogram or medication. In the Children's Heart Center, we see patients from 0 to 21, and actually even prenatally, because we do fetal echocardiograms where we do ultrasounds prenatally to look for any congenital heart disease. I enjoy being a nurse and working with our wonderful patients and families. I love working in pediatrics because I get to work with not just the patients, but also the families. And in pediatrics, working with the parents and the family is critical, and I really enjoy that. First and foremost, I want to give support because it's challenging. It's incredibly difficult to go through hearing that your child has a chronic illness or something as serious as pulmonary hypertension or something that's going to require a procedure or surgery or require lifelong medications. First, I want to provide support to the parents and to the patient, however old they are. And so that's always, top of mind. And then I want to try to provide education and help answer any of their questions so that way I can help give them the information that they need to be the best advocates for their child and provide the best care for their child. Usually on the first or second visit, the doctor identifies that a patient needs a particular medication. There are some medications for some things that can be prescribed pretty easily, and most insurances cover it. The prescription goes right to the pharmacy. And then, the family leaves here and goes right to the pharmacy and picks it up. And unfortunately, that's just not the case with the pulmonary hypertension medications. The pulmonary hypertension medications in particular require a lot more work and time. And so I think it's important for families to know and understand that for pulmonary hypertension medications, when a doctor says, I want to start you on this medicine, it's a process. It's a process to get the medication. It doesn't happen overnight. And sometimes, it may be a few weeks to even a month or more before you get the medication and start taking it. So the biggest process is the prior authorization process, because these medications are incredibly expensive. And so we want to do all that we can to ensure that the insurance approves the medication, because they're really honestly too expensive for families to pay out of pocket for. When a doctor tells me, I want to start this patient on one of these medications, we want to check and see what their insurance is, because we have a kind of a good idea sometimes of what is covered and what's not, or the process that we need to go through. And it can be a little bit different depending on the type of insurance. Some of the medications can just go to like a local pharmacy. Others definitely take a lot longer and take multiple calls of following up. And we try to do all of that for the families because it is a lot to navigate, and that's what we're here for, to try and help however we can. So insurance authorization for the medications is really the biggest challenge. After doing this for several years, we've learned the nuances of the different medications and what's required and so forth. With pediatrics, that's a very interesting challenge that some of the listeners, will have if they have a child or a teenager who is on these medications. And that is the fact that a lot of these medications, the vast majority of them, are not FDA approved for children under 18. But the problem then becomes, well, what do we use? So if we can't use those, what do we use? Our pediatric cardiologists here are extremely well-versed in the different medications that are available, and we use nearly all of them that are approved for adults. We have to use them for children because there's nothing else available, and these children are too important to wait until they're 18 to start the medication. So we fight for that, and we help to explain that to the insurance companies, and there are some more research studies being done, and some of these meds now do have approval for children, and so that's exciting too, that we've kind of made some of those advances in the care of children with pulmonary hypertension. For patients who don't qualify for Medicaid or Medi-Cal, we do have a problem sometimes where patients will have insurance, but perhaps the insurance only covers a certain amount, or they have a huge copay or a huge deductible. And those amounts can sometimes be just really too much for families to bear. So, fortunately, there are some organizations that are able to provide some assistance with copays or with prescription costs. We do run into the problem then too when patients switch insurances. So let's say you have one commercial insurance plan through your work, and then maybe you change jobs and change over to a different insurance, we have to go back and get a new prior authorization. So there are some companies that help provide medication, certain medications during that time or in that kind of situation. Sometimes, unfortunately, patients then find themselves in the scary position of not having their medication. That's always worrisome too. We've definitely been in that position where we had patients that were on medications for a long time. They switch insurance and then the new insurance says, oh, wait, they don't qualify for that. And we're like, but they've been taking it for many years. There is an appeals process. So if it's denied, we'll generally go through the appeals process, write a letter, have the physician speak with the insurance physician, do different things to try to get it approved. The vast majority of times we can still get it approved. If we're really stuck, then we kind of powwow with the physician and with the family and see if there's any alternative medication that we think might be appropriate that would help the patient and that we could, get approved. With the prior authorization difficulties that we face sometimes, we really try not to just stop if we hit a roadblock. We have to keep trying to find ways to go over or around roadblocks, and we keep fighting. I really feel like one of the most important things for all patients and families to understand is that A, we're human. We work really hard and we really want to get everything right for every patient. But B, sometimes things can fall through the cracks. And it may be that we filled out the enrollment paperwork for medication, we sent it into the company, and then, a couple weeks later, we still haven't received anything. The patient hasn't received any medication. We don't always know that unless the patient calls. So if you feel like it's been a certain length of time, it's been a few days, a week, a couple weeks, however long, and I haven't received my medication or I haven't heard from anyone, give us a call. I would always rather have families call me and follow up with me, and I can check the status and look into it and find out where it's at. But it does happen, whether it's something that either got lost in the shuffle here on our end, that we had spoken with a doctor, or it took a little bit longer to get the referral out than we had planned, or we were waiting on the paperwork and, or whatever reason. Sometimes there can be a little bit of delay in sending out the referral, but then also sometimes it either gets lost at the company or the pharmacy, or the pharmacy is working on the prior authorization, but maybe, they sent something to us and we didn't receive it, or so we didn't know. Believe me, after so many years, there can be all kinds of different little roadblocks and things that stop up the process. It's just so important. Please just give us a call. If you haven't gotten your medication, if you have run out of your medication or you are about to run out of your medication, because we don't know unless you call us, and then we're more than happy to help and see what we can do to get the process moving along. And the other thing I would say too is that it's always good to try to refill your medications as early ahead of time as they will let you. Some insurances will let you do it maybe like 5 days before you run out. And you want to try to do that because if it happens to be the month that you need a new prior authorization, or that the pharmacy needs a new refill prescription order from us, or whatever it might be, those little pieces of the puzzle can take some time sometimes. And so it's really important to kind of keep following up on those things. Reach out to your provider or to your doctor or to your nurse, and we will help you out with that. My name is Ashley Abuel, and I'm aware that I'm rare.